Hello, my name is Jocelyn McGuire. I'm a nurse practitioner at Norton Neuroscience Institute's Husson Family Multiple Sclerosis Center. Thank you for joining us for MS 101. Whether you were recently diagnosed or have been living with MS, this presentation will provide an overview of multiple sclerosis to help you manage your diagnosis and live your life to the highest quality. Multiple sclerosis is an autoimmune disorder, meaning the T and B cells of the immune system attack the immune system rather than doing what it should, which is fighting off foreign bodies like bacteria and viruses. Multiple sclerosis' abnormal response of the body's immune system is directed against the central nervous system, which includes the brain, spinal cord, and optic nerves. As MS attacks the central nervous system, it damages myelin, the protective coating around nerve fibers. This myelin covering, or sheath, is responsible for electrical impulses in the brain, so damaged myelin cannot effectively transmit nerve signals. Let's watch this short video about the central nervous system and multiple sclerosis.
Multiple sclerosis is a disease that impacts the brain and spinal cord, which make up the central nervous system that controls everything we do, whether it's taking a physical step or solving a complex problem. The exact cause of MS is unknown, but we do know that something triggers the immune system to attack the brain and spinal cord. The resulting damage to myelin that insulates wire-like nerve fibers is a disruption of signals to and from the brain. This interruption of communication signals causes unpredictable symptoms such as numbness, tingling, mood changes, memory problems, pain, fatigue, blindness, or paralysis. Everyone's experience with MS is different, and these losses may be temporary or long-lasting. Most people initially have relapsing remitting MS, where they experience attacks of new symptoms followed by periods of time when those symptoms go away partially or completely. Others experience gradual and ongoing loss of function without distinct attacks, which is known as progressive MS. MS can be difficult to diagnose, but once a diagnosis is confirmed by a neurologist who is knowledgeable about MS, there are disease-modifying therapies for reducing attacks and slowing down the damage. Growing evidence suggests that early and ongoing treatment with a disease-modifying therapy is an important defense against future attacks. There are also treatment strategies to address some MS symptoms. Options are still limited for slowing down or stopping progressive MS. Worldwide research is accelerating the discovery of how to slow down or even stop progressive MS, how to repair nervous system damage and restore function, wellness strategies such as exercise and diet that can help people with MS to live their best lives, and the exact cause of MS so that it may be prevented for future generations. To learn more about multiple sclerosis, connect with others to drive research for a cure, and to address the challenges of everyone affected by MS, visit nationalmssociety.org or call 1-800-344-4867.
There is no known cure for multiple sclerosis, but disease-modifying therapies, or DMTs, can help slow down or delay the disease. We also can manage symptoms with different therapies and medications. Not only is there no cure, but there is also no single cause of multiple sclerosis that we know of. While we suspect that there is some type of abnormal immune response, a familial disposition and environmental factors, there is no conclusive research. Research has been done to indicate risk factors for multiple sclerosis. Some of the risk factors for MS include low vitamin D levels, geographic location and sunlight exposure, exposure to the Epstein-Barr virus, the virus that causes mononucleosis, tobacco exposure, obesity, and having a close relative with MS, such as a sibling or parent. However, none of these are causes of MS. There are approximately 1 million people in the United States with multiple sclerosis and 2.8 million people worldwide. Women are 3 times more likely than men to develop MS. While most patients are diagnosed between the ages of 20 and 50, there is a pediatric onset type of MS, and older adults can be diagnosed with MS as well. Researchers have shown that Hispanics or Latinx people with MS are more likely to be diagnosed at a young age and have more mobility impairment than non-Hispanics. Also, those of African descent with MS are more likely to have a more severe disability progression and a faster transition from relapsing MS to progressive MS. You are not alone. Talk to your doctor about your diagnosis and connect with support groups to build a community. There are different types of MS. It is important to understand your diagnosis so we can best manage your symptoms. Clinically isolated syndrome is the first episode of a neurological event caused by inflammation and/or demyelination in the central nervous system, but it does not meet the diagnostic criteria for MS. Individuals with clinically isolated syndrome may or may not transition to definite MS, and using disease-modifying therapies can help prevent or slow the transition to definite MS. Relapsing remitting MS, the most common form of MS, affects approximately 85% of newly diagnosed people with MS. In relapsing remitting MS, attacks called relapses or exacerbations are usually followed by partial or complete recovery. Relapses are characterized by inflammatory attacks on the myelin and nerve fibers. Secondary progressive MS is a type of MS that some individuals transition to after relapsing remitting MS. This type of MS generally has fewer periods of relapse and a more gradual worsening of disease. You may notice a gradual worsening of walking or weakness. It is difficult to determine when someone has transitioned to secondary progressive MS other than by looking back over time. So it is important to pay attention to your symptoms and talk to your MS provider if you notice changes. Primary progressive MS is another type of MS that is characterized by early worsening of function or symptoms rather than periods of relapses. Primary progressive MS is less common than relapsing remitting MS, affecting only about 15% of individuals diagnosed with MS. The diagnosis of MS is a process that in some individuals may take months or years, and it involves a detailed medical history, family history, and a thorough neurological examination, including examination of the eyes. In order to determine your diagnosis, providers may use lab tests to rule out conditions that mimic or look like MS. Additionally, MRI images of the brain and spinal cord are evaluated. In some cases, a lumbar puncture or small amount of fluid obtained from the spine is obtained to evaluate the cerebrospinal fluid in order to confirm the diagnosis. Using these tools to confirm a diagnosis is important so treatment can be started quickly. By starting a disease-modifying therapy early, we can help to prevent damage and preserve brain health. To learn more about disease-modifying therapies, or DMTs, continue watching our MS 101 courses. Thank you for joining us. Whether you are newly diagnosed or have been living with an MS diagnosis, it is important to understand the disease so you can best manage your symptoms. You are not alone. If you have questions or would like to learn more, please contact the Norton Neuroscience Institute Resource Center.